In this training, we will discuss some of the fundamentals of good call planning and recording, as well as give you a couple of examples of good questions that can help you find out vital information about your target doctors and their offices. Effective pre-call planning includes studying your MI and MicroStrategy information, asking yourself, what do I need to learn in this call about the doctor and their practice? Then formulating open-ended questions to help you find out those answers. From studying your MI and MS data, you'll know what doctors have prescribed in the past for low testosterone. You'll also be reminded of what you've learned from this office in your prior calls. With MicroStrategy, you can find out which insurance plans are key in this area. With that information, you now know that you need to find out why they have a preference for a particular TRT therapy, whether they treat for symptoms or to a particular blood testosterone level, and who in the office is a key part of the low testosterone treatment and prescribing process. Here's an example of a simple open-ended question for either doctors or staff. Do you typically treat for symptoms or to blood levels in your low testosterone patients? If they say they treat to a number, our simple response is, that's great, since Natesto has shown to get 90% of patients into the normal range in our pivotal 90-day trial. If they say they treat for symptoms, we say, that's great, because in clinical trials, Natesto improved mood and erectile function. Are those some of the symptoms that you're looking to treat? Obviously, the call goes on to identify patients, ask for business, and discover who in the office is a part of the process. But our focus on this training is simply the planning and recording of your calls. To summarize, it's not just an important habit of all great salespeople, it's an A2 requirement that you are thoroughly planning for each call, capturing notes after each interaction, then using those notes on subsequent calls to create a continuous dialogue with your physicians.